Hey, it's Mr. X. I'm the guy behind the guide, giving you all the information you want to know and need to know about the VA claims process. So, most veterans know about common benefits like PTSD or back pain or tinnitus. But did you know that there are hidden benefits that you could be missing out on? Today, I'm revealing the top 5 VA disability benefits you didn't know you could claim. Stick with me till the end. We're going to go to the top 5, and I guarantee it's going to get you closer to that 100 club. Take it on down. Okay, it's not shocking. Scars. Number 4, you say, "Durr, Mr. X. I know I could claim scars. It's really not that secretive." Well, guess what? Scars, even while they're small things, they're overlooked. Even small or tender or painful scars are rateable. Painful scars will get you a 10% evaluation. If you have multiple painful scars, they can get you up to a 30% evaluation. Now, if some of those scars are related to your service-connected disabilities through surgery or anything else, or burn scars, if those scars also have other signs of disfigurement, hypopigmentation, hyperpigmentation, if it's palpable to the touch, all of those things, they're rateable. All of those signs, symptoms, they all go to increase your evaluation. Okay? Now, while scars may seem simple, a 30% evaluation for multiple painful scars, guarantee is going to get you closer to that 100 club. All right, tip number 2 here, not a huge shocker, erectile dysfunction. Okay, now, I know you might already be service-connected for erectile dysfunction, but guess what? Erectile dysfunction can be secondary to just about any mental health evaluation that you're service-connected for, whether that's PTSD, depression, anxiety, chronic adjustment disorder, any mental health condition. Erectile dysfunction could be a secondary condition related to it. It can also be related to other service-connected conditions that you may have, like hypertension or diabetes. It could be also secondary to the medications or side effects of those medications that you're taking for your service-connected conditions, whether that's hypertension, diabetes, PTSD, any or all the above. So, this is my tip to you. If you're service-connected for a disability, whether that's diabetes, mental health, whatever, look at those medications that you're prescribed. Go online, do a quick search of what the known side effects of those medications are. If you see erectile dysfunction, then submit a claim, prove for erectile dysfunction as secondary to your service-connected condition and the medication that you are prescribed for that condition. And then also submit any records that show you're prescribed that medication. If you're seen at the VA, it's going to be part of your VA records. But all of that goes to getting service-connected for that erectile dysfunction. Now, if you do get service-connected, it's going to be at a 0 because that's just what it is. But you'll also get service-connected or you'll get entitlement to special monthly compensation based on the loss of use criteria. Okay? That's just a little bit more in your pocket. So that's my tip to you. While it's not a huge one, erectile dysfunction, it's one that has a little bit of teeth. Okay, tip number 3 here. It's either one of those big old good ones or good old big ones. I'll let you decide. Seriously though, gastroesophageal reflux disease or GIRD, it's no joke. I have it. It's not fun to take a medication for it. But GIRD, it's commonly secondary to mental health conditions. Generally, you're prescribed a medication to help to not have the symptoms. And many veterans just deal with it. Okay. They deal with it without realizing that's rateable. But what I would do as a tip here, go down all the list of all the service-connected conditions that you're service-connected for. If you are prescribed medications for any and all of those conditions, do a quick internet search on it, your favorite browser, and look at the side effects of those symptoms. If any of them are like upset stomach, acid reflux, then there's a great possibility and probability that you can be service-connected for it. Put in a claim, GIRD secondary to your service-connected condition and the medication that you're prescribed. And if you're seen at the VA, that'll be in your treatment records. If you're not normally seen at the VA and you're prescribed all the above, then make sure that you submit those treatment records with your claim. And the probability and possibility that you get service-connected for GIRD skyrockets. You need to get to like a 50% evaluation for it. So my tip, GIRD. Look up the medications. Let's get you in that 1 hour plug. All right, tip number 4 here. Why I said it was huge this week. Migraines. Okay. Now, migraines can be secondary to like a TBI, traumatic brain injury, or a mental health condition. If you suffered a head injury or even anxiety, migraines might be compensable. Now, little known fact here, migraines could also be due to your service-connected tinnitus condition. Migraines could also be secondary to a neck or shoulder or nerve condition. Okay, migraines is one of those catch-alls that could be related to just about anything. Now, if you're asking me, and Mr. X, is migraines going to be secondary to your knee condition? On the surface, I'm going to say probably not, kind of in a different area of the body there. However, if you are prescribed medications for your knee condition and it's service-connected, look at the side effects of those medications on your favorite internet browser and look to see if migraines or headaches are a residual or known side effect of that medication, because if it is, then the possibility and probability of getting service-connected for migraines just went up. Okay? So, take a few minutes, go in, look at all those things that you're service-connected for, all the medications. Look them up. Okay? Look at all the known side effects. If you have any of them, then submit a claim, because the possibility and probability of getting service-connected just went through the roof. Tip number 4, migraines. All right, tip number 5 here, wrapping it up, sleep apnea. Now, sleep apnea can often be linked to service-connected conditions like PTSD, or anxiety, depression, or even if you have toxic exposure risk activity or TERA, like burn pit exposure, depending on if you were exposed to many different types of chemicals, asbestos, or any other solvent solutions, it could be related to sleep apnea. Okay? If you have sleep apnea in general, you're going to be prescribed a positive airway pressure machine like a BPAP or a CPAP machine. Okay? If you are, and you have one of those, that generates a 50% evaluation. Guaranteed that gets you closer to that 100 plug. Okay, sleep apnea could get you closer there. All right, wrapping it up here. In the end, don't leave benefits on the table. If you think any of these conditions apply to you, if you have any of them, it's time to take action and make a claim. Guaranteed that one or more of these conditions could be directly related to your service and or secondary to your already service-connected conditions, to include the medications for those conditions. Okay? Scars, GIRD, migraines, all can yield big evaluations and could all really be realistically, they can be related to your service-connected condition. Not knowing exactly what you're service-connected for or what medications you're prescribed. Okay, they could be known side effects. Don't leave benefits on the table. Okay, in the end, smash that like button, subscribe for more tips, and drop me a comment if you have any questions about your claim. All right, one last thing here, just wrapping up. I know it's a little bit different, the name, VA Top 5. We changed it from VA Claims Confidential, mainly because the VA Top 5, the format of these top 5 lists, we feel it's going to more closely align with what we're going to be doing, content-wise moving forward, but also with this content, it goes to directly help you, the veteran, get closer to that 100 club. That's our goal. That's why we're here, to help you. Okay? Once again, please like, subscribe, leave me a comment about what you thought, or what you would like us to address in the future. I'm Mr. X. We'll see you next time.